Hello and welcome to the Arc Woman podcast. This is an exploration of womankind. Here we discuss what it is to be a woman in the modern world while utilizing ancient and modern modalities in tandem to create a bounty of health for the body, mind and spirit.
G'day everyone and welcome back to the pod. Before we start our conversation with the incredible Dr. Ami Bhatt, I would like to pay my respects to the elders past, present and future on their lands in Litruwita, Tasmania, where I am recording this podcast today. Always has, always will be, baby. I'd like to take a moment to shout out our amazing sponsor for this episode, which makes it free for you to listen to, Ultrahuman. I've been working with Ultrahuman for a few months now. They reached out to me, and as I talk with Ami on this episode, I was initially a little bit critical because I'm always cautious about tech companies, especially after what happened with the period tracking app Flow. But the response I got from them was genuinely quite reassuring. They shared all the detailed information about their EMF testing and also sent multiple privacy statements confirming that my data would never be shared with third parties. It's only meant to help me understand my own health. I've absolutely loved using it so far. It is just a simple ring that you wear on your finger. The sensors are in the inside of the ring and they track what's happening beneath your skin and give you a range of biometric insights, which I have found really, really fascinating. For me, it's been really incredibly helpful for understanding my sleep quality, recovery, and how my body actually responds to daily habits. For example, it helps me see when I'm actually well recovered and when I should take things a little bit easier. And it even factors in things like late meals and caffeine impact on my sleep and recovery for the next day. One thing that I found really powerful was noticing a drop in my heart rate variability and recovery trends over time. And that prompted me to go and get my labs done. And lo and behold, turns out I had super low iron. When I started to address it with my doctor through iron supplementation and dietary changes, my recovery metrics have improved significantly. And this is a great real world example of how continuous health data from wearables can actually prompt you to pay closer attention to the things that you might otherwise miss. If you'd like to explore the Ultrahuman ring yourself, check out the show notes. Press the link and you'll get 10% off any Ultrahuman ring. I personally love and use the Ultrahuman Air, but they have multiple products for you to choose from that fit you. Today's guest, as I said before, is the incredible Dr. Ami Bhatt. She is a board certified cardiologist and she's currently the Chief Innovation Officer at the American College of Cardiology, where she's helping to redesign how healthcare actually works in the real world. She's also recently stepped into a brand new leadership role at the FDA, chairing the National Digital Health Strategy, which means she's actually shaping how technology, AI, and remote care like telehealth are integrated into modern medicine and actually benefit women's health. What I really appreciate about Dr. Ami Bhatt and the conversation I had with her is that she has this soul about her. She's passionate about tech, not for the sake of tech. She's all about using better systems and better data to reach the people medicine has historically missed, women. She's been a part of the innovation of telecardiology programs, designed digital care models, and is focused on one huge question. How can we make healthcare more accessible, more equitable, and more human using tech? So today we are talking about an array of different topics that interweave beautifully with one another. We're talking about heart health, stress, data gaps, wearables, AI, and how all of this might finally help women be seen earlier rather than later or dismissed. So just for the listeners meeting you for the first time, I think it's really interesting. My realm of the women who are interested in my work probably are not familiar with you and your work in any way. So if you could introduce yourself a little bit, talk about your clinical background and how you ended up working at the intersection between cardiology, innovation, and then digital health, three major passions of yours and how they interact with one another.
No, absolutely. So cardiology, kind of my base job, if you will. I was a med student who really wanted to take care of children and adults. I wanted to be able to be the kind of doctor where it doesn't matter who you are, you can walk in the office and I can take care of you. And when I did that, I found that there were some children, namely those who had heart disease, who would grow up past their teenage years, and the adult cardiologist just did not understand what they had because they hadn't studied it. It was not an old man heart attack, right? That's not what these people had. And I realized that this was, a real need of clinicians who had studied pediatrics and adult medicine and therefore could take care of these young individuals as they became young adults. And so that became my specialty, grown-up congenital heart disease or adult congenital heart disease. And in doing that, I took care of a really young group of patients. They were my age at the time, right? In their 20s and 30s. And so when they started FaceTiming and doing things at a distance, then they said, well, why can't we talk as a doctor and patient at a distance? Why am I coming into you? And so really they forced me to innovate in a way. It was their suggestion. Why can't I be at home where I live instead of coming into the big city? And, you know, if you think about it, this is true the world over, right? In Australia, how many people live in a rural part, and why do you need to come into the main city when sometimes you've already gotten your testing, you just need a conversation? So we had been very kind of doctor-centric for a long time before now. And so that was my first exposure to how do I get care into the community where my patients live? What can I bring to them? When do they need to come to me? And can we farm a balance? And so that's cardiology, but that's also innovation, which is if I wanted to take care of them when they live, then I need to figure out, how do I do that? How do I get the images? How do I get an EKG, send it? How do I use a stethoscope that's digital that records the heart sounds there, but I can hear it here? And what does all that look like? And so that was really my first foray into innovation. It was what we call design thinking. I actually took a class in it at Harvard Business School called design thinking. And it was really just, how do you design something different? Because cardiology had not been done differently before. Healthcare had not been different. Now, I was wrong about that. It actually turns out that we used to go with a black bag to our patients' houses and take care of them, right? That was the original way we actually cared for patients. We went from home to home. But then as the hospitals developed and the technology came, we pulled healthcare back to the hospital. And now my life and my job is we have so much data about a patient as they're moving around the world. We have so much ability to bring the care back to the community. How do we come full circle and end up going really back to the home using technology now? And so that's kind of how I've ended up where I am now.
Yeah, and that's beautiful. Goes into that next question, is like that front line of you being a clinician. You have a clinic, you run as a clinician, but you also at the forefront of how can we use technology? How can we move it into the home? How can we use these tracking devices? How can we educate clinicians on this? So just bringing this back to women, because this is kind of what the whole podcast is about. What started making you question about how we can use these technologies and how the current system is working and how that applies specifically to women? Because women are the caretakers of everyone. Very often they forget about their own health.
Yeah.
But they're also very interested in their health, like with wearables and things like that now.
Women
so, like,
are,
how does that step?
yeah. You're exactly right. Women are absolutely kind of they're the fabric actually of society, right?
Yeah.
And they're the fabric of healthcare. And so when we're thinking about how we are going to set up systems that work, you have to get the woman's buy-in, right? And this is true. If you are in a town and there are a few practices around, if you get the mom, you get the kids, you get the spouse, you get the siblings, you get the grandparents. You just got to get the mom into your practice and everybody else will come. But also, that mom is the person who's keeping an eye on everybody too, right? Or that woman doesn't have to be a mother, right? Who's keeping an eye oftentimes on the community. And this could even be a single woman in the community. And oftentimes they actually used to be by default the caregiver, the one who knew, hey, this is how you do that. I still think oftentimes, well, my grandmother told my mom who told me that this is how we solve for this. And it may not be in my textbooks in medicine, but it works every time, right? Tea with honey works for a reason. And so it's interesting to think about that. So one thing was women is where healthcare really happens, right? The second is they are more likely, as you said, to take care of the people around them and not themselves, which means they're more likely to be in the community. They are less likely to travel to you. They're less likely to find somebody else to care for elderly or children or do other things and come see you. And so that's one main reason to go to the community, is to get the women, right? And to offer them there. And then you're right, modern day, if you look at women in wearables, women are absolutely the ones who are driving this wearable market, right? And they're using those technologies and they're measuring themselves. And that's great because, you know, that patient agency, that empowerment is really important. Measuring your own numbers, knowing what your baseline is, knowing when things change, knowing how that correlates with your symptoms. And so that's kind of that focus. Now, separately, as a practicing cardiologist, the number of women who were missed for heart attacks, the number of women whose symptoms were ignored, again and again, I saw it. And this is kind of a social, cultural, global problem that we are dealing with, but it is in fact true. And so teaching women to advocate for themselves, heart disease is the number one killer of women. And so how do we teach people to advocate for themselves, not only take care of their risk factors, but speak up because they may not have the classic symptoms that Amanda does. We say, oh, chest pain, elephant sitting on your chest, jaw pain, radiates to the left arm. Actually, no, it might feel like very bad heartburn or reflux. It may feel like back pain in the middle of your scapula. There are so many different ways to present, and you have to be willing to put the whole story together. And so women really have to advocate for themselves. So I saw those two things at the same time. I saw that to get care into the community, you really want to get care to the women. It made a huge difference. And I saw that women were dying again and again of heart disease. In fact, there's a recent study that just came out that showed that people between ages 18 and 54, the number of people coming into the hospital, like with a first severe heart attack and dying, has gone up like over 50%. And the rate of rise of young women presenting with a fatal heart attack has gone up. And so that means we really have an urgent need right now to make sure that women watch their risk factors, but they also speak up for themselves.
Yes,
because
absolutely.
usually it's not just the first presentation. There's usually something before that. And if we were just to teach people that there's something before that, we could maybe get to them sooner.
So just going back to that, why are women's heart attacks so invisible? Globally, the burden of care of heart attacks in women is 35%. That's from the World Federation of Heart Health. What is going on? Is it because doctors aren't aware of the symptoms and the risk factors that women present with? Is it because women themselves aren't aware, or they ignore them, or they normalize them because they're taking care of everyone else? Like, is it a combination of these things? What's going on?
A combination of those things. You're exactly right? So it is a combination of downplaying symptoms because you're just too busy. It's a combination of one of the symptoms actually sometimes being kind of fatigue and that overworked feeling and people just thinking it's something else. It is a combination of not really paying attention to your own numbers, not checking your own blood pressure, your own cholesterol, not paying attention to your family history. Thinking that if the family history is in the men in the family, it doesn't affect the women. Not true. If men in your family have heart attacks, you can too if you're a woman. Right? And so that is your family history. It's not just, it doesn't run by gender. And the presentation, as we said, is different, right? Think of the heartburn or the back pain. It can be classic, it can be different. And so that's really important to recognize. And then lastly, and the part that still disappoints me, but we're working on it, is the recognition that women are not presenting with anxiety, right? Women do not need to be sent back home. They need to be evaluated as if they were a 70-year-old man with that symptom. What would you do? And we've seen studies again and again in these kind of bias studies trying to recognize implicit bias. Nobody, maybe some people, but we hope most people are not doing it on purpose. It is a vestige of a society in which women were underappreciated. That vestige still exists some places in our world, and we're working on it, but we see it everywhere. We don't see enough women CEOs. We don't see enough women pilots in kind of the corporate airlines. We don't see enough women in business. We're seeing a greater number of women going to medical school, becoming residents and attendings, but we still have fewer women in cardiology than we do men. And so there's a lot of work everywhere to be done, but I think women, first of all, have to just advocate for themselves.
Advocating for yourself is kind of an understanding of like what this looks like. So you said a few of those symptoms before, and I just really like to nail that down so women are educated. So you said back pain, you said heartburn. What are some other symptoms that might come up that signal cardiovascular disease?
So let's go with the traditional kind of example of when you have, and remember, there's so many different types of heart disease. So right now we're talking about a heart attack or a blockage in a coronary artery, which is the artery that provides blood to your body, that stops the blood flow from going any further. And then that heart muscle gets no nutrition or oxygen, and it starts to die, and it gives you pain. That's the heart attack. So that's kind of what we're starting to talk about first, right? And with that, it can be chest pain, it can be pressure, it can be tightness, it can be shortness of breath when you're trying to do something, and oftentimes it's progressive. Whatever your symptom is, whether it's heartburn or back pain or chest pain, first it may happen only with exertion, then it may happen with only a little exertion, then it may happen at rest, right? And so that progression of it's just not going away, also concerning that stuttering feel. Shortness of breath we mentioned can also be there. And so those are all kind of part of it. Reflux sometimes, if the underside of the heart's the one having the heart attack, it is near where the stomach and esophagus are. So again, the key is, people talk about this feeling of impending doom. Something is really wrong with me. I want women to listen to that. And that could be this. I had a good friend who had colon cancer, and for a year, nobody diagnosed it. And she kept going back And she was a professional person. She kept going back saying, something is wrong with me. I know something is wrong. And they said, nothing is wrong. And for a year, she fought for it, despite being in the medical profession. And finally, she was diagnosed. So it's not even limited just to heart disease. If you have that feeling that something is really wrong with you, you might very well be right. You should advocate for yourself. I'm not trying to give you health-related anxiety, right? Like, we don't want to make anxious women everywhere. But I think we've overcalled it. Women have anxiety, and we're missing diseases left and right because of it. So I think that's actually really important for us to kind of recognize, is if you feel something is wrong, you are probably right. That's why I love wearables.
Yes.
Because I love people. I love people knowing their own numbers and their own feelings. It's amazing how you can see things like, if you're in pain and you're in discomfort, your heart rate might be up and your respiratory rate might be up from your baseline. And then you look at that and you feel justified, validated. Yeah, I am clearly uncomfortable. My numbers are uncomfortable. I don't know what it is, which disease specialty I should go, but we'll figure it out. But clearly I'm validated that something is wrong. And so I really like the idea of getting to know your body, know what you're like when you're healthy, and then know what you feel like when things are off. And I think that's kind of number one, is trusting your own gut.
I love that. There are so many things that I want to say about what you said. Number one is the anxiety piece. I think saying that women have anxiety and they're feeling stressed is, number one, a self-fulfilling prophecy. If you say that to a woman, she's going to feel more stress, and she's also going to numb her feelings about her feelings of her body that are there for a reason.
Absolutely.
And it's also the modern day hysteria. It's like someone coming into your office and saying, oh, you have a floating uterus, you are just hysteric, just go home, here's some anti-anxiety medication, but actually makes your anxiety worse.
No,
and
right.
It covers up the symptom. And then also what you said about wearables and being aware of your body as well. I think that's something that a lot of women in the modern age are coming a bit home to, because the modern medicine world has almost convinced women that the feelings that they had about their body are unsafe, and that the woman's body is just so mysterious and we know nothing about it, and it doesn't make any sense. You know, Freud was always talking about how, like, it's the puzzle piece that no one could ever figure out. And now women are kind of coming back to their bodies and saying, no, actually, this is a incredible mechanism that has this perfect system that,
that's right.
You know, I have all these trillions of cells that live only for me, and I know when something's wrong. But
that's right.
They have that, and they also have all this information, and then they go to the doctor, and the doctor says, no, nothing's wrong with you. So what would you say to women that have that experience, that go to that GP that is probably overworked, probably doing the best they can within a broken system to try and get the outcomes that they need? What would you say to them?
So the first thing I say is know what you're bringing to them. We created this thing called the Apple Watch Guide, which is a guide of like how doctors should interpret Apple Watch tracings, and then how patients should bring their information. But this is true for anything, right? Whatever you're using or wearing or doing. And the reason I say that is, know the technology. If you're using a technology, know what it's really good at, right? And then be ready to kind of explain that. Like, I know this is really good for this. It's not great for that. But this thing is tracking with how I'm feeling. So know what you're bringing, what information. Same thing if you look something up, right? And you say, hey, online, I learned the following. I learned it from a reliable source. Here's where I learned it from. That's helpful for me to hear as a doctor, right? Not like my cousin's best friend's sister said, unless my cousin's best friend's sister is a cardiologist in Perth. And then I'm like, okay, well, just tell me that, right? So give me the source of where you're getting the information and tell me something about it, so I know that you're looking up reliable information. And please look up reliable information. Then next, I would say, is when you are going to go, if you know you're going with a lot of information and you know you have a busy clinician, which you probably have a busy GP, most of them are busy nowadays, we don't have enough doctors. What I would then say is go to them, and maybe even, because many of us have electronic records, or we can at least call the doctor's office and talk to them and say, I'm looking forward to seeing you in 2 weeks. Here are some of the things that I've been looking at for my own health. Don't make it 5 million paragraphs. Very clear. I'd love to talk with you about the fact that my wearable or whatever is suggesting this when I feel shortness of breath. Number 2, I would like to talk about this. I know you have things you will need to address with me. Just wanted to get this out. Now you're being respectful of their time. You have focused your information. You're not just giving them everything you could possibly look about and freaking out on them. And so I think that's probably the best way to get your GP to engage, is to say, I went to reliable sources. Here's where they are. And heads up, on the day that I come in 2 weeks, I'm going to want to talk to you about something. And I know you may not be totally ready for it, and you have other things, but like, I want to take a little time for this. So I'm going to try and focus you so that we can make time for this too.
Collaboration. I'm preparing you to take care of me. Because
That's
I
right.
think a lot of people, it's actually on my community Facebook post the other day, someone was complaining about the length of time it takes doctors to see you. And I commented on it and said, send them an email, call ahead, see if they're late. Like we don't have enough doctors. There is a broken system. They're doing the absolute best they can. And I just love that prepare the doctor in a way. I think a lot of women here will be rolling their eyes and shaking their heads. Like, I'm paying how many hundreds of dollars to prepare my doctor to do their job? I'm really sorry, but that is the system we have right now. And if you want to get the most out of your doctor, that's what it's going to take. And yeah.
And it's interesting.
Really.
Australia's system may be different than the US, but here in the US, one thing that does happen is there's a lot of pressure to see a certain number of patients in a certain day for the sake of the hospital or the practice to continue. So if you ask a majority of GPs, they would say, look, if you would let me make a salary that I could raise my kids and send them to uni and do whatever, I would rather spend 45 minutes per patient and take my time and have 15 minutes in between in case I ran over. And by the way, I need time to go to the bathroom and drink some water because I'm so dehydrated, right? I would rather do it slowly. And when I first started practicing, we were slow. And yes, I was often late because they would try and pack me in a little bit more, but I would take my time. But my patients understood. And sometimes they would call ahead and we would just say, yeah, no, she's running a half hour behind. Take your time. Mm-hmm. And then I'd call home and say, hey, I'm going to be an hour late for dinner because of this. Now, that's not ideal either. I think you have to remember that your physician would love to have time with you. The system doesn't allow for it. They're not late. They're not late in getting to you, meaning you're not waiting 6 months to see them because they're making you wait 6 months. And they're not 2 hours late to see you in the office because they're being lazy. It's because there are too many patients for however many need to be seen, and they are pushed to do that. And so I think if you go in with that aspect. Now, I tell the clinicians the same thing. Your patient is not coming to you trying to be like, I know better than you. They don't know better than you, and they know they don't. But what they are coming saying is, hey, I don't get a lot of time with you, and I know my body, and there is something that I want addressed. And so for us as clinicians, we must also enter into that relationship in a collaborative way, saying, hey, I've got 2 things I need to go over today. You need your mammogram, and I want you to get your colonoscopy, right? And I need to follow up on your acne. And these are the things we have to talk about. But I know that you might have something. Are there 1 or 2 things on your list that you don't want to walk away from today without discussing? We've got 25 minutes. We're going to figure out how to get it all in. And now all of a sudden it is a collaborative. And so it has to come from both sides.
I love that. I love where this conversation is going, but I also have other questions about cardiology and women's
health. Yes.
Just back to cardiology. And we'll get back on that train.
Yes. Relevant, because I will tell you the number of times we actually sat down calmly and then talked to each other. I heard symptoms from them that made me recognize something was really wrong.
I love that so much.
Because we weren't fighting over like, I need to do this and I want to tell her this. It was more of a, and then all of a sudden I am hearing and she is comfortable telling me. And that's when you catch things. That's when you catch cardiac disease.
And what you're saying is you actually have a relationship with your clinician, which is, I think, a lot of women feel very at odds with their clinician at the moment. And I guess I could talk about that conversation for a long time, but it is just kind of coming to your clinician saying, hey, these are the things, letting them know ahead at the time, calling if they're late, maybe taking a day off because you know that's how the medical system works, and not blaming your clinician. They are a part of this huge system. They are a cog in the machine of this huge system, and they're suffering just as much as you within this system as well. Just coming back to cardiology, I just wanted to talk about why the symptoms are different in women and men. My friends and I were talking about it last night, and I was like, I'm not going to Google it. I'm just going to ask Dr. Ami. Is it because of estrogen and progesterone? Is it because we have these hormonal systems? Do they impact how cardiology problems appear in women? And is that also why cardiology problems and cardiovascular disease kind of appears alongside that lineage of perimenopause and menopause? Because women who are pre-ovulatory or pre-menstrual don't seem to have that many problems, at least they didn't used to. And now we're seeing it appear more after that period of time.
So all good questions. Let's break it down into a few things. So one is women don't just present with heart attacks, right? We also have high rates of high blood pressure that is untreated, that creates a heart muscle that can either be weak over time or stiffer over time. And those can create shortness of breath and fatigue and other things. We can get valve disease, get rheumatic fever, and then kind of rheumatic heart disease. We can have pregnancy-associated cardiomyopathy, weakness of the heart muscle in that 3rd trimester and postpartum period. So there are so many different potential diseases that I don't want us to call heart disease just one thing. So there are many different diseases that women can have. Some of them will present very classically for what that disease is, but if people don't know about peripartum cardiomyopathy, because like when I was first practicing, the adult doctor didn't know about the congenital heart disease young adult. Still, there are many doctors that really don't know that there is a level of shortness of breath or high blood pressure or fluid in the legs and other signs that actually point towards a dangerous heart concern post-pregnancy, postpartum, right? And so part of it is just awareness. We need to teach people more. Then the typical thing that we were talking about before, the blockage in the coronary artery, right? That stops the blood flow from going through. That can happen in the big coronary arteries. We call them epicardial, they're on the outside of the heart. Or they can happen in the microvascular circulation. And women tend to in the tiny arteries that go out, right? Because you have like main highway, and then you have side roads, and then you have tiny roads. The tiny roads oftentimes get spasm or blockage in women. That does not show up in the big artery. And where everybody's used to the big artery having a blockage, so you say, oh, there's no blockage there. And meanwhile, there are absolutely ways that we can tell that there is microvascular dysfunction or microvascular disease. Now, that's not the majority of people. Women are still having straight up heart attacks, right? And why we present in different ways, even men can present with heartburn or other things too. So it's yes, there's a variety of presentations, but it's based on many things. Now, put that aside. So different types of heart disease, all of them can present differently. Less knowledge about women in heart disease. Spontaneous coronary artery dissection is another thing, which is not a coronary artery being blocked. It's a coronary artery actually kind of ending up with like a slit in it and the blood flow not going adequately through. So there's rare diseases. So lots of diseases. There's some rare, unique to women that the average GP may not be aware of. Then there's this slight difference in presentation that can occur with men and women. And then there's women coming to care late because they didn't acknowledge the first symptoms. And now we're presenting acutely. So all those reasons. Let's talk about menopause, right? Perimenopause. So menopause is the day you finish 12 months without a period. Menopause is one day. Perimenopause, right? The pre-period and the post-menopausal period, that's the rest of your life. And it is a long part of the female life, and it will happen to half the world. So the fact that there weren't enough research dollars into this is, not reasonable. And finally, we are trying to move towards correcting it. It's going to take us time, but the focus needs to be there because half the world has has a process that happens that affects their health significantly, and we have never paid attention to it before. So it is time that we bring it to the limelight, and it's not a trend, and it's not going to go away. It is a really important part of the female evolution. Now, why do I say that? Because as your estrogen levels go down, there are things that happen. And amongst them, as you become perimenopausal, your cholesterol levels tend to rise. Your blood pressure tends to rise. Your ability to take weight off may decrease. Your belly weight or truncal obesity may go up. Your risk of diabetes and obesity may rise. By the way, that trial I was telling you about earlier, that study that was showing that more women are presenting acutely with a heart attack, first presentation and death in the hospitals. A lot of those women had obesity. They had cardiometabolic or kidney disease. And so those risk factors are real. And we're seeing it more and more in young women under age 54, these women. So young women with risk factors. So as perimenopause starts, we have to watch for all of those risk factors because those are going to change. And if we can keep them under control, if we are aware, then we will likely reduce the number of events we have because we've been better at monitoring.
Right. And that is something that we're seeing. I had an episode a few weeks ago about how we're seeing an increase in breast cancer incidence in young women in Australia and just talking about all of the reasons why, and obesity, alcohol consumption, smoking was definitely one of them. And that's something that we're seeing women doing more in the modern age. I think it's dropping a little bit. Specifically, smoking has dropped significantly, which is wonderful. But alcohol consumption is still a thing. Overconsumption of processed carbohydrates. These are very often a thing.
And the rate of drug use in the study I was talking about was also higher. And so it is unfortunate, but it's happening. So we need a whole new education campaign about things we stopped doing that people are starting to do again, likely response to stress and self-medication, not enough access to mental health resources. There's a whole lot of, and just there is a clear attempt in the industry too to kind of target certain populations. And young women, right, are social media and other ways. And so there are really good things that can happen by engaging people and educating them. There are really bad things that can happen by offering them the quick out that actually might be dangerous for them. So
yes. Yeah, absolutely. I love what you were talking about before about like psychological load, emotional and stress. And it's like, it's kind of hard to talk about it because on one hand, you don't want to say that women are being hysteric and stressed out all of the time, and that's what's causing issues, and that's an issue within itself. But then we do understand from like a body perspective, if we have high cortisol, noradrenaline, adrenaline, if we're not sleeping well, if we're overeating, these are things that women in the modern world are doing.
Yes.
And I just want you to speak to a little bit like, how do these hormones and how does the feeling of stress and chronic stress impact our cardiovascular system? Because
Yes.
cardiovascular health is not something that young women like me are talking about. But if we're
And we
seeing
need
women
to be.
presenting with heart attack at 54, that's only 20
Yes.
years away from me.
No. And younger than 54, not just 50. 54 is the upper bound of where these women are presenting. 18 to 54 was the range that was studied. 54 is the upper bound, right? So let's go there. Hysterectomy is the word we use when you take out the uterus. It comes from the root hysteria. It is a ridiculous association, and we still use it today. I really want us to get rid of the word and use some other word, right? Uterectomy, whatever it is. Like, why are we still calling that? This is going to be, at some point, it's going to be a mission of mine. Hysteria is not at all what we're talking about. We are talking about women who take on the responsibility for the family and the work and the money and the care and the sandwich generation, the younger and the older, right? And do it all without complaining, but then internalize the stress of constantly thinking about what needs to get done and how to get those done. That constant process raises your cortisol. So ordinarily, your cortisol comes and goes when you're doing things that are peak or active or some stress here and there. It kind of peaks again around 4 a.m. in the morning for everybody, like roughly around that time. Of course, everybody's circadian rhythm is different. But lately, younger women have high cortisol a lot of the time. So now we are retaining some of that sugar in our body. We're holding on to things. We're not letting go because we are in this scarcity mindset of holding on to everything. We're also not taking time for ourselves because it is not right to go to a spa or take a day at the gym, right? And we're not doing those things because other things need to get done. So we're not even letting the brain rest. And that rest is so important for dropping the heart rate, dropping the blood pressure, dropping the hormones, the stress hormones like cortisol. And so, yes, estrogen, progesterone, and other things fluctuate throughout life through perimenopause and into menopause, but they are not the cause of stress. Now, is it difficult to have those hormones and do they affect other things? And do we get brain fog? Absolutely, right? Because of this, right? And are there other symptoms? Sure. Are there hot flashes? Yes. They're actually not necessarily the most prominent symptom, by the way. The brain fog and the lack of clarity of thinking starts much younger than that. There's something like 110 documented symptoms of perimenopause. 110 research documented symptoms of perimenopause. So there's a lot going on. But I want to address the stress specifically. That is not because we are aging and our ovaries are aging. That is because we have not taken the time to emphasize that women need to take care of themselves in order to take care of others. This is like the oxygen mask in the plane, right? Put your own mask on first before you do your child. And so we're really at a point where young women are pushing so hard. Now, it's challenging because we just talked before about how there are not enough women in C-suite positions. There's a glass ceiling. And so women are working very hard to get to those positions, right? And so there is a constant balance, right, of what's good for me, what's good for my career, what's good for my children. But we do need to bring it all down a little bit and allow the woman to take care of herself. And that's not hysteria. That is the adverse effects of a high stress lifestyle, which the majority of women in the world, whether you come from a developed or underdeveloped, right, like the developing country or developed country, across the board, we're kind of seeing that. And we really need to teach it differently. We talked a lot recently about generational kind of responsibility, generational angst, and really demonstrating the kind of self-care that you want the daughters of the next generation, whether yours or others, to model. And I think that's a really important part of how we think about stress moving forward.
And it is interesting that kind of cohort of women that you're speaking about are the ones that are high risk, but they are also the ones who are pregnant, giving birth,
Yes.
breastfeeding. They're at the top of their career and they do not want to give it up.
That's right.
And they shouldn't. They're also looking after their parents and their grandparents. Like I'm in this period of life now where I'm actually seeing myself and all of my girlfriends starting to go, oh, wow, we actually have a lot of people to look after.
Yeah.
And our male partners are a little bit unconcerned and we're having to kind of rope them in and remind them and be like, hey, can you call your family? I'm not going to do it for you and things like this as well. And it is interesting, that internal feeling of like, guilt or like wanting to do it for them, but
Mm-hmm.
pushing against that and saying like, no, I actually can't do this. This is not sustainable. Like this will have a down payment on my health later in life, and I'm not willing to give that up.
That's
And it is interesting, how you can absolutely see how that impacts your
I think
health.
it's almost thinking about life as we think about work as a picture of delegation. Right? So one of the best things I ever heard from a woman surgeon at Harvard who was training me, and she said, every woman needs to build her village, and you need a village for everything. You need a village for picking up your children from school. You need a village for who's at work and who's going to help who. You need a village for grocery. Like you can have so many villages. There's nothing wrong with having a shared experience with other people, or even just delegating if you can afford to do that, if you have enough people around you to delegate. And that's also true to what you just said. That's even true in relationships, right? Whether it's children, parents, spouses, or partners. This is something that I need you to do. I won't be doing that thing. Now, I often hear women say, but I do it better. I do it faster. I do it right away. I get it. We might do it faster. We may or may not do it better. It depends on like how good is good. Does it have to be perfect? Isn't good enough, right? So we have to let go of a little bit of that perfect. Like it may not be perfect, but is it going to get done? And I think the underlying greatest thing that I hear when we do work-life balance conversations, as I mentor younger women is, but if it's not done, it's still on my head as like, there's something that needs to be done. So even if I asked somebody else to do it, until they do it, I still carry it. And how does that decrease my stress? And so that is a self-work process of that is either going to get done now, later, or not get done, but it's not on me. And so you have to decide what is important to you. These are the 3 things today that are most important to me, and I will get them done. And I hope for everybody's sake, one of those things is go for a walk, check my blood pressure, make that doctor's appointment, right? Something there that actually is really about yourself. And then the other things that you consider your responsibility.
I really appreciate you saying that. And it is really refreshing from someone to hear that from someone in the work field and medicine to say that. And I think that is just, it always comes back to that in every single conversation I have with whoever is in the wellness and health field. It's always about building a community and how important that is. And that's actually one of the best longevity biomarkers that we have on women, isn't it? Is friendship.
Absolutely. Is that social connection, right? And that community that you can lean on. That is one of the best longevity biomarkers, hands down. However, it is not as good as cardiovascular disease. I just want to point out that if you are in healthy cardiovascular shape by the time you and your friends hit age 50, you will buy 8 extra years of life, just like that. No diabetes, no hypertension, no smoking. By the time you hit age 50, 8 more years than you would have if you have any of those 3 things. So please go see if you have it and fix it, because you can't buy 8 years with any longevity drug, process, exercise. Like you can't buy that kind of longevity. I will just admit for a moment, I got lectured yesterday by my own administrative assistant. She is about 15 years older than me, very nice older woman, has been working with me for quite a while. And she said, "You're packing the schedule too tight." I said, "No, I'm going to slow down." And she said, "Well, you said that last year and you said that the year before. And I really hope that this year you do it." I got flat out yelled at by her, right? Like, and she said it so calmly and so sadly that I was like, but I felt it, right? She said, "You're teaching it, you're saying it. I am watching you. You are revving up again. You need to stick with it." And so even I, who can talk about it and I really think about it and I try, even I kind of fail at it. So don't kick yourself if you're not exactly there and super zen yet. Just keep reminding yourself, remind your friends around you, try to have them remind you, you remind them, right? And keep at it.
And you have 2 daughters, is that correct? They're watching everything you do. And if they see you burn out, they're going to think that's normal. And I have that same story with my mum. She works and works and works and works. And I say to my partner, "I'm going to slow down next week." He's like, "I don't think you will. You never really do." So I think most women in the health field, we almost feel this feeling of responsibility and that we can't stop and that people are depending on us in a way. But then, you can't talk the talk if you don't walk the walk, basically, can we?
And the one thing that's 100% true, and I had a hard time admitting this for a long time, is I could stop working right now and somebody else and other people would pick up whatever I did. And it might not be exactly the way I do it, but it'll get done. Nobody will parent my children. Nobody will take care of my parents. Nobody will be the spot that I have kind of in my community of friends and siblings. There's nobody that can replace me.
Our health is irreplaceable. And I guess this is actually a really beautiful way to start talking about wearables in a weird way.
Yes.
Because when women are caught up in that, I think we go out of body and we spend a lot of our time in our heads and we start to forget about what's happening down here in a way. And I think wearables are a really nice little reminder, like a little app on your phone. Hey, your resting heart rate was really high today. Hey, your temperature at night was a little bit elevated. Hey, you didn't get that much sleep last night. And so these things that we usually put on the back burner and completely ignore, now we get an app on our phone and it zones us in and we've become quite aware of it. And wearable technology is something you're really, really passionate about. We were speaking about it before, and I'd like to loop back into that. I want to talk about this practically. How do you think wearables are applicable in women's life specifically? Like, is it a band? Is it a ring? Does it attach to an app? Do you just mind explaining what wearables are for the audience that has been living under a rock and isn't aware of them, basically?
No, absolutely. So the idea behind wearable technology is whether it's, a watch or something you wear on your wrist, or if it's a ring, or if it's a different kind of wrist gadget, what you want to do when you're wearing it is, first of all, the goal is not for you and it to become obsessed with each other. Now, I know a lot of people say, oh my God, I'm obsessed with it. I look at it all the time. I'm constantly, and I love that. I love when that happens. But for those who may be living, not under a rock, but those who aren't already in that wearable camp, right? Like, I love the people who are in the wearable camp. Great. Like, you love your numbers, you monitor, you read about it, you learn about it. Great. But for everybody else, find something that, first of all, you forget you have on. So like, I love this because I forget that I have it on. It doesn't, it's just there in the background. Some days I will look, and the things I look at is, what is my resting heart rate? Is a lower resting heart rate look like, right? What does my blood pressure trend say, and how is it doing, right? Maybe how's my respiratory rate? Although COVID era aside, right, or flu season aside, where I think respiratory is really important. I am a cardiologist, so the heart rate just like takes the priority for me. So I'm a little biased there. But also, how am I doing in terms of exercising? Like, have I done good work for my body today? Can it tell me that I've been active today? Have I rested enough, right? Not just sleep rest, but even just body rest, right? Because the thing that women tend to do, and I am the ultimate culprit of this, is weekend warrior. Oh my God, I'm going to get in shape. Go, 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 go. Hurt something. Wait. Don't do anything. Go, 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 go. And I've done this in my life so many times that anybody who's watching this who knows me will be like, oh, yep, that's her. That's exactly her, right? Is this weekend warrior concept? And a lot of women have that. And what I really like about wearables is their ability to say, go, hey, don't go that much. Go some. Did you rest? I don't see any rest in today. Like, when's the last time you rested? Let's take it easy, right? Let's do some walking. Let's do some standing. And so I think that's one thing that I want people to remember, that you don't need to watch it every day. You don't need to log into your app every day. You need to wear something that you're going to keep on that's comfortable. So don't wear something bulky or uncomfortable. You won't use it. And you need to know yourself. So if you need something that tells you about sleep because you're kind of like really thinking about sleep, then get something that tells you about sleep, right? If you are somebody who just says, hey, I want to know my baseline, then get something that gives you a baseline and not just 2 weeks of a baseline. You know what I want to know? I want to know from age 35 to age 54, what happened to me over time? What was my heart rate overarching trend? What was my blood pressure trend doing? How was my heart rate recovery? How is my sleep changing in the perimenopausal period? I want this data to be like my partner data in terms of longevity, right? Like, but not just for like, for living longer. I just mean, I want something that's going to help me look at myself in a few years from where I was and show me my own personal journey. Because whatever numbers I give you as a cardiologist, I've done it based on a study. And by the way, most of the studies are based largely in men. So I can give you a number and be like, your number should be roughly this. And yeah, it's probably true. But actually, no, now we have personalized medicine. Now we have, here's your range. And by the way, you're right, Dr. Bhatt. Like, your sleep has really gone down. You used to sleep 8 hours, 7, and now 6 hours. Maybe that's an early sign of perimenopause. And then I want the wearables to offer that. So if you're going to wear a wearable, find an app that doesn't just say, here's your number, you did well, you did well. Find an app that says, hey, here's kind of some things, and here's some education about what that might mean. And here's how you interact with it. And you want a calm app. You do not want an app that alerts you constantly and is freaking out. You want one that says, hey, here's the range of what normal should look like and what abnormal should look like for you. Don't worry about it. You're a little up here today. Tomorrow we're going to move down there. You want something that really, and I keep encouraging wearable companies, and I work with all of them. I keep encouraging them to really be a place where there is a companion for the woman in her wearable and not a judgmental one. And that's how you want to feel when you use your wearable.
Yes, absolutely. I couldn't agree with you more. And just talking about some of those metrics, you said heart rate variability and blood
Yes.
pressure, like the two that stand out for you. What are some other metrics that you think women should be like if they're purchasing a wearable, it should include? Can you give us like 5 or 6 off the top of your head that you're like, these are
I
really
love,
important ones
yeah.
that you want to look at?
Heart rate is a basic. So definitely heart rate. Most that have heart rate have the ability to tell you if you have atrial fibrillation or not. It is a diagnostic tool, but most have it, and most have it kind of FDA approved. And so especially as we're getting closer to age 60, that'll probably just be in there. I'm not saying it's a must have. I'm saying generally the good ones will have it anyway, right? Blood pressure doesn't have to be an exact number. It's going to be really hard for wearables to give you an exact number. There is one continuous blood pressure monitor out there on the market right now, but you don't need that. You just need trend. Your blood pressure seems normalish. Your blood pressure seems out of range. You should still be using a blood pressure cuff to kind of check blood pressure for now. Even those, though, the studies show that we don't really do them right. Nobody sits for 5 minutes, breathes slowly. You don't do that. You throw the thing on, you do it, right? And you move. So it's hard to say, but therefore I like the trend. I don't need to know your exact number right now, but I need to know when you're out of your own range. And then I need that to kick you into action, right? So heart rate, the AFib diagnosis helpful. Blood pressure trending, really important to me. Where are you relative to your baseline? They will all give you heart rate variability because they give you heart rate. Like how much is your heart rate kind of changing throughout the day, and kind of more variability is kind of good. You don't want to be stuck. And then I guess a couple of the other things that to me is increasingly your oxygen consumption. It's called VO2. And it's like how much oxygen your heart and your lungs use together. That's getting better and better. And you can get that from a good number of these wearables and apps. I like that as a metric of like, how in shape am I? Whether or not that number is exactly right, if you did it in a hospital with me where I do these kind of tests and I wear a mask and I have an IV and I measure you, no, it may be off, okay, maybe quite a few points off. But again, if whatever it is reliably tells you your baseline, then if you start to get in more shape and you see that number get better of your VO2, you're like, yeah, I'm doing it. And if that number starts to get worse because you are not doing as much, right? Or if you're not feeling well, the number's getting worse and you have some hard things, right? Like, so I think just knowing your baseline relative to how it's changing is important. So heart rate will come with heart rate variability and atrial fibrillation most likely. Respiratory rate is in everything. And so it's not bad, especially with, a lot of the respiratory diseases coming back cyclically, right? I think it's good to kind of have, right? Especially COVID, flu, RSV. And then VO2, this oxygen consumption. I really like that one as well. And then I personally also like this idea of activity. Now, there can be activity like how many steps you took. Sure, if it gets you going, like do the steps. But I also like how much did you push yourself? How much did you rest? I like the balance of it, right? I spent some time sitting, sometimes standing, sometime active. I spent some time in strain, some time in recovery. And of course, each company has their own way that they kind of think about it. But if you look at athletes, they don't go, 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 go. They recover. And women like me are at the biggest risk of go, 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 weekend warrior. I'm going to do it until we hurt something. And
Yes.
so I like this idea of kind of like recovery also being an important part, and then sleep, of course, being important. So those are the things.
I think the activity component is really, really important because generally we are seeing women under exercise chronically. And I think with the wake of cycle syncing, which I think has had some benefits, but the integration of exercise and movement into that, I don't think it's not backed up by science. I don't follow it at all. But like we are seeing women under exercising. So I think if they set themselves a goal of 8,000 steps and they're surprised, oh my goodness, I don't walk at all. Okay, I need to work on that. And then that is like, oh, maybe I'll start going to the gym. And if you do have a positive app that's actually collaborative with you and isn't scary and it's not giving you like an overall age, like you're 8 years older than your chronological age, that's terrifying. Like if that's on your app, just delete it.
Exactly. You're like, I don't want to do that. And if you're going to tell me that, tell me why then. Tell me, hey, you're walking a little less than you should. That's giving you a year. Hey, you're a little bit overweight. That's giving you a year. At least do that. And then I can be like, oh, look, if I get my steps up, now my age comes down a year. And you're like, okay, if you're going to do it that way, then you're working with me. But if you just say, bam, you're too old right now, you're like, oh, there's no hope. By the way, two of my very best friends and I all do this now. We are all physicians. One is an internal medicine. One is a GI doctor. I'm a cardiologist. We will literally just walk around the house to get our steps in because the weather has not been polite here in the northeastern United States. And so just walking around, and now the family's used to it. They're like, oh yeah, mom's getting her steps in. So going back to the daughters and what they see, I would love for them to see me going to the gym, but lately I've been going too much and I'm throwing out my back. So now I got to do the walks around until I'm good again. But even that, right? That counts. So it doesn't have to be gym. It doesn't have to be impressive. It just has to be activity.
And seeing that, I think a lot of women with ADHD as well will have that little dopamine hit, like, oh, tick, I've done my steps today. This is really wonderful. And it almost gamifies it in a way, which I think is really wonderful. Yeah. I think that I've been thinking about specifics to steps. I thought about this the other day. I have like a biometric ring and I put in my height when I put in everything. And I was wondering, have they based the pedometer off of a male body and they're just applying my height to it? And it made me start thinking about this, okay, wearables are wonderful, but what is the data we're putting into the wearable that's having them associate my baseline with the data that's been input into this model? Can you speak to that? Because you work with these companies. Are they actually actively working on women biased data and making sure that they're using at least sex aggregated data so they can input into their system so it actually reflects women's health accurately?
So you're asking a great question. So there's two things. One is the original data upon which approval was based for certain things when they first started. And this depends on FDA approval or CE mark or not, right? So we're talking about like medical versus health. But let's just say wearables in general. I don't know in the beginning. I don't want to speak out of turn. I suspect, I'm almost certain that most wearables started out being more male heavy, more male predominant, right? What I will say is the focus on the use of wearables by women, the focus on capturing the real world data now from women to be able to inform the technology even better, to be more relevant for women, is 100% increasing. And so I am sure of that because they come to me and they say, can we talk about women's cardiovascular health? How are we going to be more relevant to the woman? And so I'm definitely seeing companies that are now definitely focused more on features for women's health. There's, period tracking and other things that people are doing, but also capturing those women's data to be able to make the algorithms more appropriate for women. And I just can't speak to every single, there's so many wearables out there in the world. And I just don't know which ones were based on what percentage men, women in the original studies that set up their algorithms. But I will tell you that the big ones have routinely been coming back to me and said, hey, we're going to really make sure to focus on women. We're going to get this data. We want to study it. We want to improve our algorithms with it. So I think we have made our point and people are now paying attention. But you're right. It may not be perfect for you. And this is what I keep coming back to people about is it's important for women to participate. Wear the wearables, get your data. Obviously, make sure the wearable you're wearing has privacy, security, right? You're not giving your health data to people. You're not selling it to people. You got to check for it. But assuming that's all true, get involved in clinical trials, right? If women get involved in clinical trials, then those drugs will be oriented towards women, right? Because we'll have enough women data. And so I want women to be more involved in the healthcare field in a safe way so we get the right data so we can do the right thing. In the meantime, even if these aren't built ideally for women, which they may not be, some things, like I'm not sure which ring you're wearing, right? And so like things like that. If it gives you something that feels like a baseline number and you don't put too much effort in the direct number it's giving you, but you do look at fluctuations, that's the real value of wearables today. Your personal baseline, your fluctuations from your baseline. Don't compare to your friends. Don't compare to a male friend, right? But just your number and fluctuations relative to that and getting a sense of listening to your own body. That's probably the most important part while we continue to get more data and make these algorithms really accurate for women.
And I'm also imagining these biotech companies are internally collecting data on women. Yes. And that's improving their algorithms as well. And I guess the important part in that, I think, that women are quite afraid of is that, okay, this data is being processed and understood internally. That's awesome. That's one thing. But sometimes this data leaves. And so just last year, I think it was 2 million Canadian women created a class action lawsuit against the period tracking app Flow. Have you heard about this?
I thought you were going to go to Flow. Yes.
Yes. And so when I started working with a biotech company and looked through their privacy data, looked through their EMF readings, they approached me and I was like, give me all the information right now. I don't trust you. And when I came out and was like, I'm using this biotech ring and this is what it's showing me about my sleep. And this is how it helped me diagnose my low iron because my blood pressure was really high. And
Right.
this is how amazing this technology can be at picking up things before it gets really bad. The outcry I got from women was, I do not trust these companies because of what happened with Flow specifically.
Yes.
So how can women make sure that their data is not going to be sold or exploited? Because biotech data is a gold mine.
It is
And
a gold mine. It is a gold mine. You have to directly ask the company. You really have to have people who push the companies to say that they are doing it in a protected way. I was at a menopause event at the Whoop offices, and it actually came up. There were two women, Susan Sly and Mia, her partner, and they were talking about, they have this new platform called Oz, and they were talking about how important it is to really demand that the company talk about privacy and how they keep your data and that they don't sell it. And the people from Whoop there from the science team had said, we don't do that. And Flow came up there. Fun story. I didn't only use Flow myself. I bought it for my daughters. Me, right? I was so excited to be so forward thinking. When Flow first came out, I was there in line. Look, people are right. And you realize that you make mistakes. And immediately, as soon as this all started coming out, took ourselves off of it. But our data was somewhere out there. We're part of the class action lawsuit. And I thought, oh, and so that ended up being a conversation that I forgot to have with my daughters. And so after I came home from that event, I said, hey, by the way, this is why we don't use that app anymore. We never really talked about it. I just kind of took it off of all of our phones. But this is how careful we have to be about our privacy and our data, et cetera. And so it's hard. And I think you have to ask the companies, but at the same time, mistakes happen when you're trying to be forward thinking, when you're moving. And so you just have to keep reminding yourself to really make sure you understand the kind of privacy and security of the data that you're giving. But I understand how those 2 million women felt. And I understand how they mistook what they were doing for something good, because I was kind of one of them. And sometimes once you learn the lesson yourself, though, you're not going to make it again.
Yes, definitely. And I think it is on the onus of the woman to really ask those questions. As someone with a huge following, I take it very, very seriously. Whenever a company reaches out to me, I am very, very critical.
That's right.
And then once I found that company, I'm like, okay, the values of this company do definitely align. But then it's also assuming that it's going to change and coming back. I think the main thing that happened last year as well was with Aura, who for some reason thought it was a really good idea to team up with the US Defense Force and Palantir. And they didn't really understand that the ethos and the zeitgeist of their consumers were vehemently against that. And they lost their huge consumer base, and they've lost a huge amount of stress, which is really quite disappointing, because them as a company and as a biotracking company, they were one of the first, and they've really set the tone for, and I think everyone's watched what happened and said, oh, we're not going to do that.
No.
We're going to make sure our privacy is updated, and we're going to make sure we're consistently telling our audience that we're never going to sell their data and it's not going anywhere. It's going to occur inward. It would be interesting, though, in the future to get a notification on my app saying, hey, there's a clinical trial open. You can join just by way of having this app. And by having this wearable, do you want to have your blood pressure monitored and given to this research base, and you'll be a part of the study, and it's totally anonymous and it's not going to go anywhere else? That's wonderful, because women don't have the time to go to a clinical trial.
100% what we are aiming for. So I have had a few conversations just this week about exactly that, is how can we now take the information internally, take the information about trials, bring that information internally, not give your information to them to see if you're eligible, but take their information, bring it in internally, do the internal matching and say, hey, you seem eligible. Here's the information about it. Here's how you would learn more. By the way, we're not going to give your information to them yet. We can even have you have a conversation with somebody about it, whether that's going to be a bot, asynchronous, just read information, or if you want to talk to someone live. I think all of those should be options for women, because some may just say, just give me the reading, I'm good. Others may say, I want to ask a few questions. Can I kind of agentic AI, like ask a couple? They're probably frequently asked questions and you have answers for them. Or I want to talk to somebody because I'm a little hesitant, and that's okay too. And it'll probably not be the majority of women who want to talk to somebody, but for those who do, there should be somebody. And so this is something that I'm actually literally actively trying to build, because cardiovascular studies need this for women. And the trackers actually help us identify. It's not always easy to identify somebody who needs, asthma research or rheumatic disease research. But for cardiovascular research, like this is actually one way that we can start to identify people as they're putting their data in. I will say, so next week there's a conference in the US called the HIMSS conference. It's like a big hospital IT conference that happens. And I'll be with Sumbul Desai, who is the VP of Health at Apple, and they've put their health and their fitness units together just recently. They used to have them separate, and now they're all kind of under Sumbul in one unit. And I was laughing because I've seen billboards, not this year, maybe last year, big billboards when you're driving down the highway that were about Apple's security, like, privacy starts here, right? And I don't remember it. Their team was much better than that. So I'm sorry to their marketing team that I'm not doing justice as to the loveliness of what they had put up, but I thought it was really clever. And so I thought, hey, like, do we really need to cover privacy and security when Sumbul and I are on stage giving the keynote next week? Like, there's so many other things to talk about. And one of the conversations I had this week was, we always need to talk about privacy and security. We should include that in the conversation. So I'm so glad to hear you saying it too, Sarah, because sometimes I wonder whether people have heard enough about that, but then you remind me that even myself, I have fallen into that trap. And so we should keep bringing it up. And so this was a nice actually moment for me to take from you and what you've learned from your audience and bring it back and say, yeah, we will emphasize privacy and security on stage as part of it.
Women need a lot of reassurance in the privacy and security of their data, especially after flow. I think that really sent shockwaves through. And it just really comes back to that whole, we need to build a lot of trust. Women feel very at odds with the medical system. And I think it would be really beautiful to see more of a cohesion in this space, because women are upset that we don't have that much data on them, but they also don't have that much time. They're taking care of everyone else. Coming to the hospital to go and have their blood pressure tested is just not viable. It's just not going to happen. But then I've had researchers on my podcast before saying that women are the most amazing participants when they have time to do it. So I could imagine it would bring up lots of different bias in research, I can imagine, but it might even be cheaper for them to say, okay, we're going to purchase at cost 200 rings and we're going to send them out to our participants if they don't already have them. And then we're going to test this thing for this period of time. You might be compensated, you might not. That can all be run through the app. And that really does introduce a whole different element to the research space, which is going to be completely new.
But it's the way to do it. It is where we are headed, Sarah. You are predicting the future right now. And I think that future is maybe 6 to 9 months away, where wearables are an entry point to women, everybody, but women coming into these trials, participating. And I'll tell you why, because they're also much better at patient engagement. The biggest problem we have in clinical trials is we lose patients. Like, even the most willing patient who wanted to do it, it is exhausting to come in and get your blood pressure taken the number of times you need to be in a registry or trial. It is. And the things that we give you to keep you engaged are not seen frequently enough. They're not engaging you. But these wearable companies, gosh, they're excellent at patient engagement. So in fact, for a clinical trial to successfully engage and retain patients throughout until the end of the trial so we can get all of our data, we need a patient engagement engine, and that could be the wearable. So it really works for everybody. It works for the patient, it works for the wearable companies to be able to get more data and build better algorithms, and it works for us as clinical trialists to be able to keep our patients in care and ideally keep them home a little bit more than how much they have to come in right now for studies.
And when we see people in their daily lives, we are getting a more accurate representation of what they look like. When someone's sitting in a research chair and having their bloods done, I mean, that might change a little bit. But your blood pressure is something that changes all the time. So I can't imagine that, like, coming into a hospital setting. And for some women, maybe their blood pressure might be lowest in that setting because it's the first time they've sat down all day and they're not doing anything. So I think that's really
a great point.
Well. Yeah.
I love that point, Sarah. Everybody always says when you come to the hospital, your blood pressure is probably higher, and your point is well taken. No, I don't have the kids. I'm not cleaning the house. I'm not at work. I'm just here and nobody's talking to me. My blood pressure might be lower.
Because I had my blood pressure done recently because my iron is a little bit low, and my GP and I are working on it. And she said, your blood pressure is normal. And I was like, no, it's not. This is the first time in the day that I haven't been thinking about a million things that I need to do. The next thing I want to talk about, okay, wearables in women, clinical research, that's amazing. We're going to see a whole lot more research on cardiology specifically and everything else. We're going to see sleep studies, VO2 max, steps, all of these things are totally applicable. And we can run multiple studies in one period of time, which is incredible, just from a data set perspective. Then we're going to see more studies in science. So at the moment, I think it's 21 or so, 2.2 million new studies are published in, I think, about 22,000 journals every single year. It's like a mind-boggling amount of research. No doctor can keep up with that. And so that is a nice prelude into the next conversation around AI. So the AI and wearables have kind of come into the market at the same time and has been freaking out the wellness communities. No one really knows what to make of it, but you really are at the forefront of how you communicate this. How you talk about this is collaboration instead of the fear that I think a lot of people think when they think of AI entering the wellness space is I'm just going to go onto a toilet and it's going to take my stool sample, my urine sample, a blood sample. It's going to compute everything and it's going to tell me what to do. I don't think it's going to be like that at all. We're still going to have a front-facing human, but we are going to see AI working with clinicians because no clinician can remember that amount of study.
So three things. So one is the AI for the back office stuff is all here, right? Efficiencies, supply chain, authorizations for insurance. Yes. Okay, great. We've done that. I'm not going to focus on it right now. Now there's generative AI, asking questions, getting information. And what I like to call this is navigating to knowledge. Let's start with the doctors, the GPs. You're right. You sit in front of me. You have 3 chronic diseases. There is no way that my human brain can find out everything I need to know about those diseases, the research that's done, the guidelines, your health record yourself, your personal values, right? Your socioeconomic status and abilities, and your wearable data in the 30 minutes that you and I are sitting together. Not a chance. I cannot provide you with the highest level of scientifically rigorous care possible and a holistic approach to who you are in 20 minutes. But AI can grab a whole lot of that and can present to me the summary of the things that I might most need to know about you. Then make sure that I touch upon all those things to give me guidance. And then I can pick from that and talk to you again collaboratively about what your priorities are. And then I can do it. So we can navigate to the right knowledge and give it to our clinicians. But then the clinical acumen and the relationships still fall face to face. That is what I am hoping that we continue to build for the future. It's what we're working on right now. Having said that, that's a long way off for every single clinician to have, right? So in the meantime, what can we use these systems for? So one is patients can actually use them. And this is similar to when we talked about wearables earlier. Patients can use these to start to learn a little bit about what's going on, the health forward ones. We have to make sure that we have like health appropriate ones, right? I'm not saying go use anything. But if I create that for cardiology, right, for my patients, then they can use it to help educate themselves a little bit about what's happening. I can also create that for my patients at discharge when they're leaving the hospital. Because you know what? When I left the hospital with my first baby, I was so exhausted. I don't remember what the nurse said, but I was sure that because I didn't hear it, I was going to kill the baby. By the way, the baby is now almost 19 years old. But like, I was just terrified. Wouldn't it have been great if there was an iPad with a chatbot or something where my discharge instructions, I could play and replay. I could ask questions. She would slow it down. I could ask her to explain it a different way. I could do it again when my mother came in the room and when my husband came in the room, and we could ask again. And the discharge nurse, who's so busy on the labor and delivery floor trying to get everybody home, she did not have that kind of time for me, not her own fault. And so those kind of places right now for our patients, so important. We can create the knowledge we want to share and we can help them. And then I would still see the nurse, but I would have all of this in addition. So there's navigating to knowledge for the clinician. Give me all the information. Let me use it then and process and use it to the best of my ability. There's information for the patient. Let me tell you what you need to know about your heart. And you can go over it again and again in the ways that you need to be able to understand it, tell your friends, help your family understand. So let's use it that way, right? And so I think those uses, there's a third use of that type of technology, the chat GPT, right? Large language model. And that is, what if I'm a nurse in a rural area and I have 50 sick patients in front of me? Is there a way by entering their data, it could tell me these 10 are sicker, most likely than the other 40? Yeah. And then those 10 go first, right? Or those 10 get sent to the big city and the other 40 who may be less likely to be sick, they get a follow-up with me in a week to make sure that that was right. Now, of course, I always use my clinical judgment as a nurse or a doctor. If I disagree with the AI, I'm sending you to the big hospital because I think you're sick and I can see it in you. It's never better than me, but it actually may help me slow down, see things, understand, or it may see trends that I don't see. And if I believe that from what I'm seeing and from what it tells me, I can get you to help. So really, rural health, the areas that are underserved, may really benefit from this kind of AI, and I'm excited for that. So we talked about administrative AI, hospitals. Then we talked about using it to make the clinicians smarter and get that data, and then use their judgment, make the patients smarter because they can ask again and again and learn and imbibe that information. And then to kind of upskill people in the community. It can be a community health worker to triage people to the right level of care. So that's the area that I think is going to grow in the next 3 to 5 years. We're going to do. there is a last area, because we say AI and we don't all mean generative AI. There's AI, which is machine learning, which is, here's a chest x-ray, this is a pneumonia. And then you teach the computer, right? Chest x-ray pneumonia, chest x-ray no pneumonia, chest x-ray pneumonia. And you do it 1,000,000 times, and now that computer can say, chest x-ray pneumonia, because I've seen 1,000,000 versions. We already use it. When I read a CAT scan or an MRI, there's already a little summary. Hey, the computer already read it, and this is roughly what's happening. And then I kind of can start from there and confirm. But what if it didn't only do that? What if it said, hey, Dr. Bhatt, you're reading studies 1 and 2 and 3, but number 3 is a deadly one. I'm going to push it up in your list. Read it next. Get to that patient sooner. Those are the kind of things I really want to see AI doing. Us thinking about what they're offering us and then doing something even better, because we know as patients and as clinicians what we need. And so a lot of promise for AI. The approach is the same. I used an AI to look this up, doc, when you go to your GP. I used a reliable one. I didn't just use any large language model. I used the AI that you gave me. By the way, docs, you should probably have a reliable AI you give your patients at some point. We're trying to develop them for you, right? And so I think that conversation is really important. Like, I'm looking things up out of respect for you. I'm curious about it. I know that you're the expert, but here's what I found. Do we have time to talk about?
Yes, I love that so much. And I guess educating the audience on doing like a literature search. I think I am working with a company in Tasmania, and one of the marketing firms came to me and said, have you used ChatGPT's deep research? And I'm like, yeah, it's an amazing tool, but read the research. Like, don't just take that lit review. Don't just get it to do a summary for you, because it won't be able to dissertate the information correctly. Like the risk ratio it's saying in the summary here actually doesn't match that study. And sometimes the DOI link isn't the same. It makes mistakes. And so I think that's really interesting, is using that AI model and getting your doctor to suggest one to you. And usually it's the one that they are most familiar with. I think at the moment there is a mass exodus away from ChatGPT and towards Claude, and we'll see that for lots of different reasons.
That's right.
I think that is interesting, having the patient go, okay, something is wrong with me. I'm going to input the array of symptoms that I'm experiencing into an AI type model that my doctor is familiar with and agrees with, and I ethically am behind. And then I'm going to take that, I'm going to look at a literature review, and I'm not going to trust the summary. I'm going to read the studies, and I'm going to send that to my doctor. My doctor has an AI model behind as well, which is also doing its admin and is allocating patients in order of emergency. And if I am in order of emergency, I'm going to get an appointment sooner rather than later. And then it's just this cohesion of the tracking that we're wearing that we can input into a trusted AI model that then maybe we can get research papers on and have more data specifically on women. And then your doctor is actually able to dissertate through relevant information at warp speed to be able to help you. Yeah. So it's like, that's kind of how I'm seeing it as well. So I think it's so beautiful, the collaboration and cohesion between these models.
There are 2 or 3 things that come out of that. And I know that we're almost at time, but so one is, when we are using these models, kind of ask these questions, how we use them matters. So I know that it feels very easy to use these tools, but you know that there are people who can create a gorgeous piece of art that looks like it belongs at a museum using AI. And then there are others who make something that look like our 4-year-old drew it, right? And that's about prompting. That's about how you use the tool. And so I would encourage all people to not just dump information, to actually learn how to give the information and how to request the output to get the best response you can. Don't assume these tools just work. They don't. Learn how to ask a good question and get the kind of answer, and then work with it. Don't take the first answer. Judge it again. Say, is there, even like your example, Sarah, one could say, thanks for that. Can you double check all of the statistics and numbers that you have in here and make sure that you can find an exact page where that same number is replicated in the original research? I say that all the time. And half the time they'll be like, actually, these 7 don't have anything. And I'm like, great, thanks. Okay, yeah, so can we fix them? All right, so you have to work with it. It's not a magic bullet. So that's one thing. The second is, there's this idea coming out of world models, which is life isn't just words. Large language models just associate words with each other. Life is images, life is feelings, life is, right? There's so many other things. And so we really need to put all of them into AI to better understand people. I don't think that's happening tomorrow. But the reason I say it is, whatever we're working with today, Sarah, if you and I had the same conversation in 6 months, there are going to be totally different tools available to us. And so what we do need to learn, especially as patients, but more importantly as clinicians and systems, how do we constantly evaluate all these technology changes and decide when we want to adopt a new one, when we should stick with what we have, and when we're just not ready to try something new. And that is new for us because we used to just, this is the way you do it in healthcare. And now this is the way you do it is not the way you do it. It's constantly changing. And so we really need to teach. The new leadership is, how do you lead through continuous change? How do you help people who live in a changing environment? And how do you evaluate the new technologies constantly without going crazy and raising your cortisol, right? How do you evaluate it to know, hey, this might be a good time to engage. This is not a good time to engage. This may be something we want to use. This may not be something we want to use. And so that is something that we need to learn and teach.
What would you say to women, just to close up, on how they can find a wearable they trust? And what exactly does woman-centered digital medicine actually look like when we take into account AI modeling and learning models and also wearables and trackers and things like that as well?
Yeah. I would say the first is understand like who's in your market, right? Like wherever you are in the world, what are the wearables that kind of are most common there, have the most data kind of in your area, right? And understand why people are really doing it. Are they doing it because the marketing is excellent? Are they doing it because the wearable looks like jewelry and some people don't even charge it, they just wear it, right? Are they doing it because they use that wearable for other things and it happens to also tell you about health? And so one is just understand what's happening around you. Just look around at your friends, look in the grocery store, and just see what people have. And you'll get a sense of in your area what's carrying, and then start to understand why. And then know why you want to wear it. Like, do you want to wearable because you're not ready yet, but you kind of just want to like look like you're in the know? Like, that's okay. That's step one. That's fine. Do you want to be able to do your text messaging from your wrist, right? And then if it also tells you your heart rate and it's keeping track of everything, that's great. Or do you want something because you want to continually get data over a longer period of time and look at your trends? Is that what you're looking for? And so each wearable has its own highlight of what it kind of does better and does worse. But I would look around you and then I would just assess, like, do I want jewelry based? Do I want multifunctional? Or do I just want health in the background? And I think that's step one. And then once you do that, you'll see that there's probably a couple global brands in each of those categories, but then there's probably also local brands. And then you look at price points and understand what you're going to use. And then you'll see what your friends use and maybe see whether your friends are willing to get the same wearable as you so that you're kind of doing it together, right? And so I think that's part of it. And then definitely look for the wearable companies that are openly stating in their marketing, we are focused on women, right? I think that's really important. The ones who say, we get it. And yes, we may be focused on other things, but women's health is important. They should be saying it out loud.
And they should be proving it too. Like if you look on their websites and they're saying, hey, we have an application for pregnancy, we have an application for cycle tracking, we have an application if you are on hormonal birth control. Like if they are saying that they are for women, you should be able to look on their websites and find very clearly that they are actually creating applications with their wearable that are applicable to women's health and the multiple different stages of women's health as well. Yeah.
And then I think the last thing is true for any digital health company. And you taught us that today, Sarah, which is the ethos of the company, I think matters. How they interact with the world.
Beautiful. Any last words that you'd like to share with everyone before we close up?
No, this was magnificent. What I love the most is that we are on kind of opposite ends of the world right now, and yet we are experiencing the same things and thinking about the same things. And it just makes me feel kind of closer to you and all the women who are listening in between us. And so I really think there's a lot that can be done. And the more active women are in this process of thinking about what does health mean, the faster we're going to make some improvements.
Beautiful.
Thank you so much for taking the time out of your busy day to listen to this episode. If you loved it, please remember to like, subscribe, and send to a loved one. If you want to learn more from ARC Women, please check out the website at arcwomen.com.au, where you can find a plethora of offerings like charts, masterclasses, courses, and organic clothing. You can also head over to patreon.com/arcwomen or substack.com/arcwomen to join the community. I hope you have a really beautiful morning, afternoon, or evening wherever you are in the world, and I will see you on the next episode.